This work is work between the ECOA committee along with the Scientific Evaluation Committee. And the two committees are working together in order to develop some more strict and best practices for validation and implementation of migrating paper clinical scales to electronic clinical scales. So it's been a long-going concept of how much validation is necessary after migrating a paper scale to an electronic format. There are a number of papers and guidelines written about general validation and what it takes for patient-reported outcomes, or PROs, as well as clinical reported outcomes, CLINRs. So in the MDS Society, we're in the process of reviewing any new version of an electronic format that a company wants to use for their study. After they get the proper licensing, then they can create that electronic version, and we have to review it to make sure that it fills all the requirements and is a direct replica of the paper scale. And we realize we don't have the guidelines that we want to ensure consistency. With just a few of us reviewing it regularly, there was a lot of consistency in our reviews because of the institutional knowledge. So what we want to do is to take that institutional knowledge, document it, so that other committee members, when they are reviewing the screenshots of a newly developed e-scale, that we are following best practices and have those guidelines. We created a current rough draft of the guidelines that we're going to do across the two committees. The next steps are to get those evaluated by committee members and industry and movement disorder specialists, so that we can both understand from the clinician perspective as well as the industry perspective why these guidelines may or may not work. And then those best practices will be used both within MDS for our ECOA reviews of electronic versions, but then published so that those can be used by others in creating guidelines.